Okay, so melatonin. Melatonin has got some really wild new research coming out, and it's very interesting. Now, melatonin, of course, comes out of the brain. It seems to go up when we go to sleep. If you take it, it may help with going back to sleep. They talk about using it for if you have trouble, changing time zones, with trouble getting back to sleep and things like that. There's some other interesting research where the giving patients melatonin prior to a traumatic surgery decreases their pain. So it may be a pain reliever. And there's this really wacky line of research about Alzheimer's. Now, Alzheimer's disease is increasing in our society at quite a rapid rate. And so you might ask, why? Why are there so many more people getting Alzheimer's now? Well, think of our society, of how it's changed from the past, and we're going to come back to that question in a minute. There is a way to produce a kind of brain damage in rats that looks a little bit like Alzheimer's. And basically you inject an adrenaline-like drug into the brain, and the telomeres, which are little things on the end of your chromosomes, get tangled up, and that looks like some of the changes in Alzheimer's. And if you give those mice or rats who get this injection melatonin, it helps block that damage. Now, our society has lots more light and noise and music, and we get less sleep than we used to, and melatonin helps us sleep, and we're having more Alzheimer's, and melatonin in mice, I like melatonin. I think it's a good thing. Melatonin releases growth hormone, which is good for us. Those of us who are middle-aged men could use a little growth hormone to help trim our stomachs. That's okay. So I like melatonin, and I'm interested in it. We're going to keep looking at the research, but I think everything I can find out, it's non-toxic. It may help you sleep. It might help protect against Alzheimer's, which would be unbelievable. It may help increase growth hormone. So yeah, I like melatonin.
Aside on that, you might find that you mentioned that I was taking Ambien, and you can tell me, why don't I try melatonin? I told them to try melatonin, and really, really weird dreams, really weird.
Yes, it can give you some real dreams.
I decided, okay, I can do anything. I took it again, and now I'm not having those. So
yeah,
it was.
The first time, your first new experience with it, it's common to have people report the kind of those dreams, kind of the wacky dreams, but then as you get used to it, that tends to go away. You had a question?
What is the growth hormone? I mean, what's the benefit of increasing growth hormone?
All the wacky people who are drug doping so they can play football better, lift weights, run faster, they're all taking growth hormone. Our growth hormone levels start to decline after our peak years, which for men is, and women, it's a little older. Except in my case, I'm still at my peak. So baseball players and all this, they're all injecting growth hormone, and it builds muscle. Some people, there are doctors who run these kind of wacky anti-aging clinics. They're injecting people with growth hormone and things like that. And I'm not sure I would do any of those things, but growth hormone helps build muscle. It helps burn abdominal fat. And it gets lower as we get older, and a lot of people think that we could do with a little bit more, and as an interesting side effect of melatonin, it stimulates a little bit of growth hormone, so I don't think that's a bad thing. And I certainly like it a lot more than, say, Ambien. Okay. All right, now we have some staples to come out. Staples here or staples upstairs? Okay. What's your choice?
I'll face that way.
You'll face that way, but you'll still do it? Okay, good. All right. Come on up.
I can do that.
What if you don't have to show your tummy? You're okay? Okay.
Video's running.
Now don't stand in front of the camera, otherwise you'll be permanently immortalized. Immortalized. Immortalized? Is that what happens when you come to Las Vegas? You become immortalized? You sure you don't want to show that? That looks really good. Now, what I do is I look at this. If it looks good enough, then I have her turn. I think it looks good. Yeah, they look like they're feeling great.
No, there's
Yeah. Okay, applause. Now you can, since nobody could see, you want to tell everybody that that didn't hurt?
Yeah, it did not hurt.
Yeah, that looks good. Okay, good. Normally when people take their clothes off, oh no. This is Las Vegas. Huh? Yeah, I mean, how many other doctor's offices do you go in where you have somebody taking off their clothes in front of you at the doctor's office?
There's a lot of things here are different.
This is a Las Vegas clinic visit here. Okay, applause. And
I'm an engineer kind of guy, and I looked at that tool, and I looked at it, couldn't figure out how we were going to use it.
do you want to do that way, or?
Yeah,
Okay, we could go in the closet here.
but they have HIPAA laws and everything, but are we allowed to ask about Shelley?
Yes, unfortunately, she's still sick. I don't know why. Yeah, we re-explored her yesterday. I'm really worried about her. So, if you want to stop by and say hi to her, I know she'd appreciate it.
Okay, she's still at Eleanor.
She's still stuck up there, yeah. Oh, good. I'm glad you can't see this one. There's a bruise there.
Ow! Did that really hurt?
You should have did that one on the last one.
I can't seem to get this one out.
You're right, I should have done that.
My Hippocratic oath prevents me, but I think about it. Just tugging on that like nobody's business. Okay, applause. And she does have a bruise at a couple of the sites. Those things shouldn't be a big deal, and that should get better. So, okay, so for our patients last week, last chance for questions before we dismiss you and